In terms of deciding that I wanted him to be my surgeon, obviously everything I saw on the website, all the reviews were very positive. I also think that the 2 consultations I had in Connecticut actually helped solidify my decision to go with him. So one of the surgeons I met with, she actually used to work with Dr. Carling at Yale, and she had departed for a different hospital around the same time he departed for Tampa. And so what was interesting is that she actually is familiar with the mini back scope procedure. That was her preferred method for removing adrenal glands. Unfortunately, because I have a very tiny frame, she was concerned that she wouldn't have enough space to go in through the back. And so she still wanted to do an abdominal approach. But when it came up that I was going to go see or, meet with Dr. Carling, do the consult, she immediately said, not only was I going to be in good hands, and she was so supportive of me taking those steps, but she also said, he's done a lot of these. He will probably go through your back. She said, I'm not comfortable, but hands down, he's probably going to take this approach with you. So that was kind of like, push number 1, that this is probably the right decision. The second surgeon I met with was not a great consult. He wanted to do everything that Dr. Carling's website recommends not doing. And he also insinuated that because of the size of my tumor, that no one would take it out through my back. So that one was kind of like, well, I'm not going to choose him. And that also helped solidify my decision that Dr. Carling would be the best choice. So I think by the time I got on the phone with Dr. Carling, I kind of had already, I knew a lot of what to expect. He just briefly asked me for my history. He said he saw all my records because I had actually sent him the consult that I had with the surgeon that he used to work with. And she had also ordered some additional labs to make sure that my tumor wasn't secreting cortisol, which I guess can happen rarely. So he had reviewed all my documents. I don't think he had my CT scan images at the time, but he had the report. And he just said, I think you're a perfect candidate to do the mini back scope. That's the approach I'm going to take on you. And I was like, yeah, sign me up. Like I had made up my mind before we got on the phone that this is the direction I was going to go. So I said, sign me up. What do we do next? And he said, I'll have my intake coordinators reach out to you and we'll schedule the procedure.